So on the screen, what you're seeing is a 5-implant scenario, a 15mm cantilever and 15 Newton force. And you can see the forces are predominantly on the distal 2 implants. The most distal implant is under compression, and the one further forward to it is under tension. The implant in the middle hardly contributes to anchorage of the prosthesis, and this is also likened to 2 implants that are placed very close together. You have to question whether they're really contributing to the distribution of load along the prosthesis. Now, if we take this scenario and we eliminate the center implant, what I want you to pay attention to are the 2 numbers at the bottom of the screen. And you can see that the forces really didn't change much. Now, if we go one step further and we tilt the distal implants, you can see that there is a significant decrease in the amount of force. And the question now becomes, why did this force decrease? And the simple answer to that question is that we are decreasing the amount of cantilever. Cantilevers are very detrimental to implant-supported restorations, and any opportunity that we can get to minimize the cantilever is great. Now, with tilting the distal implant, we have some other advantages also. We can essentially place the implant, we can place a longer implant, we can avoid anatomical structures, we have increased bone-to-implant contact, so there are many advantages of tilting that distal implant. So what are the conclusions from those studies? We do know that the implant closest to the cantilever is under compression. We do know that cantilevers are bad for implant restorations, and any opportunity we get, we should minimize it. We do know that the arch form distribution is much more important than the number of implants. And one thing we also have to realize is that the same loads in different patients may respond very differently, and that is on an individual to individual basis.